Hey guys, welcome back to my channel. Welcome to another edition of Health Class. So today, wala muna tayong Celebrities Get Sick 2 edition. Pag-uusapan natin ang isa sa pinaka-common na cancer amongst women. We are celebrating women's health. Ito ay endometrial cancer. Ano nga ba ang klase ng cancer na ito? At ano nga ba ang survival rate ng mga babae na may endometrial cancer? Magagamot pa ba ito? At kung magagamot pa ito, ano nga ba ang possible management and treatment para mapagaling ang isang babae na may endometrial cancer? Para sa karagdagang information, just keep on watching. My name is Ryan and I'm specializing in primary care, diabetes, men's sexual health, alcohol and drugs, and medicinal cannabis. Like what I told you earlier, we will be discussing about endometrial cancer. Ang endometrial cancer ay isa sa dalawang types ng uterine cancer. Ang isa ay tinatawag na uterine sarcoma na very rare. Ang endometrial cancer ang pinaka-common sa dalawa. Ano nga ba ang endometrial cancer? It is a type of cancer that begins in the lining of the womb or uterus. Most cases occur in women after the age of 55. That's according to mayoclinic.org. Yung mga babaeng 55 years old and over, sila ang at risk na magka-endometrial cancer. Kadalasan silang nag-experience ng menopause. But first, ano nga ba ang uterine? Ano nga ba ang uterus? Para malaman natin kung saan talaga nagsisimula ang cancer nito, i-review natin ang physiology ng uterus. Sa Tagalog, matres. Ito yung uterus, ito yung fallopian tube, ito yung ovaries. What are the key signs of endometrial cancer? Ang keyword din is abnormal vaginal bleeding. Ano nga ba ito? Abnormal vaginal bleeding, such as bleeding after menopause or bleeding between periods, or bleeding not related to periods. Over 90% of women diagnosed with endometrial cancer have this symptom. Other signs, such as pelvic pain or pelvic mass. That means nagkakaroon ng pananakit sa may pelvis area at meron ding cyst, lumps, or mass sa pelvis area. Pain during sex, pain in urination. Pero alam mo ba na may mga babae din na may endometrial cancer na walang symptoms at all? Kaya a regular checkup with your doctor is needed. Ito pa ang ilan sa mga information about endometrial cancer. Approximately 15 to 20% of women with endometrial cancer may not have any symptoms. Endometrial cancer grows from the endometrium, the inside part of the uterus, into the surrounding muscle layer called the myometrium, towards the outer lining. It can also grow into the adjacent fallopian tube, which are attached to the uterus, then the ovaries. Ang endometrial cancer ay nagsastart sa endometrium. Ang endometrium ay ang inside part ng uterus. At ang cancer ay nagsisimula specifically sa lining ng endometrium. Tapos, kumakalat ito sa myometrium. Ang myometrium naman ay ang muscle layer ng uterus. Hanggang sa kakalat ito sa labas ng matres. Kakalat din ito sa fallopian tube na naka-attach sa matres hanggang sa kakalat din ito sa ovaries. So remember yung sinabi ko kanina na ang key sign ng endometrial cancer is abnormal vaginal bleeding. Pero ano nga ba ang abnormal vaginal bleeding? Ano nga ba ang hitsura ng bleeding na ito? Ito ay tinatawag din nating discharge. Ano nga ba ang kulay ng discharge? The vaginal bleeding or vaginal discharge look like watery, pink, or white instead of red. Nearly 70% of women diagnosed are with early stage of uterine cancer. This is when the cancer is still within the uterus. So kung nakaka-experience kayo ng abnormal bleeding or discharge na medyo pink ang color or white, instead of red or dark red, magpatingin na kayo sa doktor. Ano nga ba ang mga management for endometrial cancer? Ito ang ilan sa kanila. Meron tayong tinatawag na hysterectomy or surgical removal of uterus or tinatanggal ang matres. Usually, the ovaries and fallopian tubes are removed as well. So, tinatanggal din ang ovaries at fallopian tube. Kasi naka-attach naman ang fallopian tube sa uterus at ang ovaries naman naka-attach sa fallopian tube. At ang tawag sa operasyon, pag tinatanggal hindi lang ang uterus pati din ang fallopian tube at ovaries ay bilateral salpingo o oophorectomy. Pero pag uterus lang ang tinatanggal, ito ay tinatawag na hysterectomy. Pero nga, kasi ang fallopian tube ay naka-attach naman sa uterus at ang ovaries naman ay naka-attach sa fallopian tube, pag tinatanggal ang uterus ay tinatanggal na din ang fallopian tubes at ovaries. Para na din mapigilan ang pagkalat ng cancer. Meron din tayong tinatawag na radiotherapy. Gumagamit ito ng radiation para mapatay ang mga cancer cells. Meron din tayong immunotherapy. Ang aim nito ay palakasin ang body's immune system para labanan ang cancer cells. Meron din tayong targeted therapy. Gumagamit ito ng mga medisina para labanan ang pagkalat ng cancer cells. Meron din tayong chemotherapy. Pero most of the times, chemotherapy is reserved for advanced stages ng endometrial cancer, such as stages 3 and 4. Siyempre, pag cancer ang pinag-uusapan, kailangan din nating pag-usapan ang survival rate ng endometrial cancer. In an England study between 2013 and 2017, stage 1 had 90 out of 100 survive for 5 years. In stage 2, more than 75 out of 100 survive for 5 years. Sa stage 3 naman, more than 50 out of 100 survive for 5 years. At stage 4, ang pinakalala, more than 15 lang out of 100 survived for 5 years. Ano nga bang kaibahan ng stage 1, 2, 3, and 4? Pag stage 1, ito ay ang early stage ng endometrial cancer. Nasa loob lang o hindi pa siya kumalat. Pag stage 2 naman, kadalasan kumakalat na ang cancer cells sa may cervix area. Pag stage 3 naman, kadalasan kumakalat na ito sa vagina at sa ovaries. Pag stage 4 naman, ay posibleng kumalat na ito sa other parts of the body. Ano nga ba ang cause ng endometrial cancer? The exact cause is still unknown, but could be due to mutations or changes in the DNA of cells in the endometrium. The mutation turns normal and healthy cells into abnormal cells. The basic principle is healthy cells grow and multiply at a set rate or normal rate. Pag abnormal cells naman or cancer cells, they grow and multiply out of control and they don't die at a set rate. These abnormal cells continue to accumulate, meaning pag nagmamultiply abnormally itong mga cancer cells, nag-accumulate sila, dumadami sila, forming a mass, a lump, or a cyst.
Metastasis is the spreading of cancers to non-adjacent organs. Cancer cells from the original tumor or primary cancer can break out and may be taken up by a blood or lymph vessel for a ride throughout the body. They can then squeeze out from the vessel into other tissues and start a new tumor growth in the new location, which will become secondary cancer. While traveling in the bloodstream, a cancer cell usually stops at the first place where the vessel is getting so narrow that it gets stuck, as blood flow from most organs goes to the capillaries of the lungs. This is where cancer is spread the most. Lungs are indeed the most common site of secondary cancers.
Siguro ngayon nagtatanong na kayo, ano nga ba ang mga risk factors ng endometrial cancer? Ito ang ilan sa kanila. Changes in female hormone levels, fluctuations in the balance of estrogen and progesterone can cause changes in the endometrium. Estrogen and progesterone are female hormones. Kadalasan, pag mataas ang estrogen at mababa ang progesterone, nagiging at risk ito in the development of endometrial cancer. Isang risk din ang more years of menstruation. Meaning, pag nag-start ka nang nagkakaroon ng menstruation at an early age, for example, before 12 years old, or nag-menopause ka ng very late, it increases your risk kasi the more menstruation, the more exposure to estrogen of the endometrium. Remember what I told you before, pag mataas ang estrogen, risk factor yan for endometrial cancer. Never been pregnant. Older age. Kadalasan nangyayari ang menopause at age 55 years old and above. Obesity or pagiging mataba. Body fats alters hormone level. Ang ibang mga babae ay nag-hormone therapy at tinitake nila ang drug called tamoxifen. According to studies, tamoxifen can increase the risk of endometrial CA or cancer. There you go guys, sa mga kababaihan natin dyan. Like what I told you earlier, ang isang key sign ng endometrial cancer is abnormal vaginal bleeding or discharge. At anong kulay ng discharge na ito? Kadalasan ay pink or white. And usually, this is in between periods or nangyayari na lang ng bigla na hindi related sa menstruation ninyo. And ang at least nito ay yung mga babae na nasa menopausal period na o yung mga babae na age 55 years and above. It is very important for you to consult your doctor if you think that you have the key sign or if you think that you have the signs and symptoms of endometrial cancer na na-discuss ko earlier. Salamat sa pakikinig at panunood. I will see you again on my next health class. Stay safe and be healthy. Or mapiprevent ang na pag nagmenopause, they undergo hormone therapy. Paano nga ba maiiwasan